In hospitals across China, scenes reminiscent of the early days of COVID-19 are unfolding once again. Emergency rooms are overwhelmed, pediatric wards are at capacity, and healthcare workers are racing against time to treat a surge of patients struggling with severe respiratory symptoms. But this time, we're not dealing with COVID-19. Instead, we're facing a wave of Human Metapneumovirus, or HMPV, a pathogen that's been silently circulating in our communities for years, but is now making headlines across the globe. Human Metapneumovirus might not have the name recognition of influenza or RSV, but its impact on global health has been significant and sustained. First discovered in 2001 in the Netherlands, this respiratory pathogen has unique characteristics that make it particularly challenging to control. During the first 4 to 6 days of infection, the virus reaches peak infectivity, creating a perfect window for rapid transmission before many people even realize they're sick. What makes HMPV especially intriguing to epidemiologists? Its transmission pattern. Unlike viruses that cause single large outbreaks, HMPV creates multiple sub-epidemics, each with its own distinct genetic signature. This means that at any given time, different strains of the virus might be circulating in different communities, making it harder to track and control. The seasonal patterns of HMPV tell a fascinating story of viral adaptation to different climates. In temperate regions, the virus typically reaches its peak activity in late winter to early spring, with March often marking the height of transmission. However, in tropical and subtropical regions, the story changes dramatically. Take Peru, for example, where research has shown that HMPV demonstrates extensive genetic diversity with frequent viral introductions, but limited local persistence. When it comes to symptoms, HMPV presents a complex clinical picture that varies dramatically across age groups. The typical course of infection lasts between 2 to 5 days, but for some, the impact can be far more severe and long-lasting. Let's break down the numbers. HMPV is responsible for approximately 5 to 10% of all hospitalizations in children, with about 16% of these cases developing into serious pneumonia. For infants under 1 year old, the risk is particularly acute. These tiny patients often present with severe respiratory distress, bronchiolitis, and in some cases, such significant breathing difficulties that they struggle to feed. But children aren't alone in facing serious risks. Among elderly patients in long-term care facilities, the statistics are truly sobering. Mortality rates have been reported as high as 50% in some studies. For immunocompromised individuals, particularly those undergoing hematopoietic stem cell transplantation, the mortality risk ranges from an alarming 10% to 80%, depending on the specific circumstances. The severity of HMPV infections is significantly influenced by pre-existing health conditions. Research has shown that 6 to 12% of COPD exacerbations can be directly linked to HMPV infections. For children with asthma, the numbers are equally concerning. Between 8 and 14% experience acute exacerbations following HMPV infection. Congenital heart disease adds another layer of complexity, with affected children typically requiring longer hospital stays and showing worse severity scores. The impact on those with neuromuscular disorders is particularly challenging, as these conditions often impair respiratory function even before viral infection occurs. As we speak, China is grappling with an unprecedented surge in HMPV cases. The situation is particularly severe in northern provinces, where hospitals are reporting massive influxes of patients, especially children under 14 years old. What makes this outbreak particularly challenging? It's occurring alongside infections from Influenza A and Mycoplasma pneumonia, creating a perfect storm of respiratory illness. In response, China's National Disease Control and Prevention Administration has launched a pilot monitoring system, specifically designed to track pneumonia of unknown origin, learning from experiences during the early days of the COVID-19 pandemic. This system represents a crucial step forward in early detection and response capabilities. The international response to HMPV has been multifaceted. Health authorities worldwide are implementing comprehensive prevention strategies, drawing on lessons learned from previous respiratory virus outbreaks. These include enhanced surveillance systems, strict laboratory reporting protocols, and public health recommendations that emphasize the importance of proper ventilation in indoor spaces. The role of international collaboration cannot be understated. Research partnerships between institutions in high-income countries and those in low- and middle-income countries have led to improved clinical guidelines and better access to diagnostic tools. This collaborative approach has been particularly crucial in regions where HMPV is becoming increasingly prevalent. When we look at the data, certain populations emerge as particularly vulnerable to severe HMPV infections. Children under 5, especially those under 2 years old, face some of the highest risks, with approximately 10% of hospitalized children experiencing life-threatening complications. For the elderly, particularly those in long-term care facilities, the risks are equally severe, with some studies reporting mortality rates up to 50% among confirmed cases. Pregnant women represent another vulnerable group, as physiological changes during pregnancy can impact both immune response and respiratory function. Additionally, individuals with chronic respiratory conditions face heightened risks. Studies indicate that HMPV can significantly exacerbate these underlying conditions, leading to prolonged recovery times and more severe outcomes. As we face this emerging health challenge, the importance of a coordinated global response cannot be overstated. While we currently lack a vaccine for HMPV, our understanding of effective prevention measures has never been stronger. The implementation of proper hand hygiene, mask usage in high-risk settings, and maintaining appropriate physical distance from those showing symptoms remain our primary defenses against transmission. As we've learned from previous health crises, early awareness and proper prevention measures can make a crucial difference in managing viral outbreaks. Share this information with your community, especially those caring for young children, elderly relatives, or immunocompromised individuals. Remember, in the face of emerging health threats, informed communities are resilient communities. As we continue to monitor the evolution of HMPV and its impact on global health, one thing becomes increasingly clear. The landscape of respiratory viruses is constantly changing. Our best defense lies in staying informed, maintaining vigilance, and working together to protect our most vulnerable populations. The challenge of HMPV may be significant, but through understanding and coordinated action, we can work to minimize its impact on global health.